Hey, everybody, and welcome to All About Health. We're brought to you and we are sponsored by All American Wellness. All American Wellness is there to meet all of your functional health needs. We always provide a free 15-minute functional evaluation. So if you're having an issue with your health, just simply go to allamericanwellness.com and make an appointment. If you're a phone type of person, then just call us at 561-863-8779. We always provide that free 15-minute evaluation, and we can tell you within a short period of time whether you have a functional problem or you may have the beginnings of a disease and pathology and the proper physician to consult and work with. We're also being brought to you today by Podcast Junkies. If you're looking to get your message across to the masses, then you really need to see Mr. Ben Castro and Mr. Christian Perillo about bringing your message to the masses. That's podcastjunkies.com, Junkeez. I really would recommend them highly. I've been utilizing their services for close to a year now, and I am totally satisfied and very impressed with them. So thanks for joining me today, and we're going to talk all about health, but I'm going to focus in on automobile injuries, some specific areas, because we're fortunate enough to have a very seasoned and professional who represents Lytle and Ryder. This is a premier law firm that is located in Palm Beach County. So we'll be talking with Mr. Steve Sanchez in a few minutes. But for today, I do want to talk to you about two specific things that have to do with automobile-related injuries. And they are largely overlooked and undervalued, and they need to be brought into your forefront of your mind. So should you suffer an automobile trauma, you are well educated on what to do in regard to these two types of injuries. The first is a TBI injury, and the second is an AOMSI injury. And for those of you who may not know what that is, a TBI is a traumatic brain injury, and an AOMSI injury is an injury to the ligaments that stabilize all 7 bones in your neck. And they're very important to be looking for that type of injury. Those injuries can have a very detrimental and long-lasting effect on your life, your health, and your future. So we'll talk about that for a couple of minutes. At All American Wellness, when we have a patient come into our facility, the first thing we look for are those TBI injuries, those traumatic brain injuries. And as with all medical professions that you go into, they ask you to fill out paperwork, right? And sometimes that can be fatiguing, and we're concerned about that and conscious about that. So the first piece of paper we have them fill out is the subjective sheet that looks for concussion or traumatic brain injury. And we time the patient and how long it takes them to fill out their paperwork. Believe it or not, after doing this for so many years and so many thousands of patients, we have an average of what length of time it should take for a potential patient to fill out their paperwork. So with this piece of paper in hand, I immediately start looking for the 10 most common signs and symptoms of a concussion. And I delve into those particular areas with the patient when we do a history. Having discussed that, I want you to understand anytime you're involved in an automobile trauma, the potential for a TBI or traumatic brain injury or an AOMSI for that matter are very great because the one area of your body that is not protected by the 3-point safety harness is your cervical spine and your brain housed in that bony area of your body called the skull. When you're involved in an automobile accident, it doesn't matter from what direction that accident occurs, the head and neck are thrown around in multiple directions, multiple times, and your brain literally slams against your skull multiple times, and this creates an injury. Many times, the emergency medical services will pick up on that catastrophic type of injury. They will screen you for that type of injury. They will decide at the scene whether you are a candidate and need to go to the emergency room. And when you're in the emergency room, make no mistake, they are screening and examining for life-threatening problems. If you do not have an imminent life-threatening problem in the emergency room, you're released. Now, you could be released with an injury that's going to have long-lasting effects on your health and your life and your future, but you're not suffering an imminent danger of losing your life. So this is how I come to see these thousands of patients over the years that have gone to the emergency room, been released, and have functional brain injuries. They have problems filling out their paperwork. They have problems with headaches, head pressure, or mentation issues, meaning they're not thinking clearly any longer. Their recall, their ability to bring up certain words, their stability and balance, their ability to sleep properly, their appetite, all can become affected with these types of injuries. And they're very all-encompassing and can absolutely have an effect on your future if they're not picked up on, addressed, and treated properly with a neurological emphasis at rehabilitation. The same thing holds true for the AOMSI injuries. Yes, and I know you're dying to know what that means. It's the alteration of motion segment integrity. Your bones in your neck need to move in a very synchronous manner. They all have a special job to do. The ligaments help them with that. And once that specialized tissue called ligament has been damaged, that's a permanent injury. You can treat it. You can try and help it as best you can conservatively, but ultimately patients that suffer this type of injury will eventually end up needing to have stabilization surgery. And without it, they're going to suffer just incalculable amounts of problems and issues that will affect them until, in fact, they do find the right treatment for their problem. We do this at All American Wellness, not the surgical aspect, but we screen for these TBIs and AOMSI injuries. If you don't come to our facility, have that on the tip of your tongue to ask your doctor, whoever that may be, are you looking for these type of injuries, doctor? And hopefully they're telling you, yes, we're doing that today. And that is what I would recommend to you. We are located very easily to wherever you live if you're in Palm Beach County. And if you don't already have a physician that you're happy with, we're more than happy and honored to take care of your injury and healthcare needs. In the meantime, enough about me and enough about the TBI and the AOMSI injuries. As I said, we are fortunate enough to have a seasoned, regal professional with Lytle and Ryder, and I'm going to turn over this show to Mr. Steve Sanchez so he can speak to you about the all-encompassing issues above and beyond the clinical aspects that affect you when you're involved in an automobile trauma. So enough of my blah, blah, blah. Let's turn this show over to Mr. Steve Sanchez. Mr. Sanchez?
Thank you, Kevin. You have a way with words. You know, you were talking about traumatic brain injuries, and those always resonate with me, or those injuries resonate with me, because many times we have clients that come to us and they know that their neck hurts and their lower back hurts and they've got some pain into their extremities, but they don't always understand or appreciate that they may have sustained a closed head injury. And sometimes they're not in the right state of mind to be able to self-assess. And so they may come to us and they may have confusion, lightheadedness. They may have visual disturbances. They may just have a tough time with short-term memory. I've had clients come to us and they can't remember even small details about the crash or moments before the crash, or things that for whatever reason at the time, they may dismiss it because they are in the middle of this trauma that has just happened. But you slow things down and you take them through, tell me more about what you're experiencing and what hurts and what you're feeling. And I think many times that's where you have to come to the realization that they need to see someone that specializes in not only the evaluation of these injuries, but treating these injuries. One thing that I have found is that with clients that suffer these injuries, there typically is a mechanism of injury. They've hit their head on the A-pillar, on the headrest of the seat. And then sometimes there is no mechanism where there is the head actually colliding or striking with something inside the vehicle. Certainly, there's medical literature that confirms that you can suffer a closed head injury in the absence of hitting something inside of a vehicle. And I also meant to mention to you that even beyond the typical car accident case that we typically investigate, many of our cases involving, for example, a slip and fall, where someone goes into an establishment, they fall down, hurt themselves, maybe they hit their head against a concrete floor, marble floor, same scenario. They come to us, they're disoriented, they don't feel like themselves. They're having all of these symptoms that they're having a difficult time being able to actually process and hey, what is this all about? And we actually have cases that we handle as well where there's explosions, for example. And same scenario, they've got all these different symptoms. Maybe they haven't necessarily had a direct trauma where their head has struck something, but they are just off. They don't feel right. They're dizzy. They have, again, all of these different symptoms that we've talked about. And again, the distressing part is that they may not necessarily recognize that this is what's happening. At that time, during those moments with me, they are not able to grasp that maybe I have suffered a concussion,
Excellent
a
point.
TBI, or something else. And so, again, that's where for me it becomes critical to have someone, a professional like yourself, who's able to diagnose these injuries and then decide what's appropriate, whether it's diagnostic scans or perhaps an evaluation with a neurologist or otherwise. So from my perspective, even though at times I certainly, we do our best to see if there is something that we need to be aware of, it's oftentimes we leave it to the medical professionals to assess and treat. What I would also say is that this becomes part of the conversation about what's significant in a case that we might handle. Meaning, again, you have a client that comes to us, my neck hurts, I'm having pain in my lower back, I've got some pain in my arms, I've got airbag deployed, hit my face. But you have to be considerate of the fact that if there are other injuries that need to be assessed, not every medical professional is well suited to assess those injuries. And that's where it really,
So true.
you have to be able to have some say in, hey, look, this is something that I think you need to look into, because otherwise they go to someone and it doesn't get addressed. So that's a factor. Then beyond those things, it's a matter of looking at how do you get compensation for someone who has been through a traumatic brain injury, which again, maybe at the beginning, it may not be a big deal.
Real
but
challenge. Yeah.
I've worked with clients who've suffered TBIs, and it's horrific. It's not something that resolves necessarily over time. Even if you get the appropriate scans and there's some wonderful medications that they can prescribe, but I will tell you that these are injuries that are long lasting. And as I said, it is a consideration when we are assessing the full magnitude of someone's injuries and damages.
Did you hear that, folks? That's so important that you're with an attorney firm like Lytle and Ryder, someone who works hand in hand with a professional, where each professional is watching the other professional's back for the benefit of the client. So important.
Absolutely. Something that oftentimes happens is I have clients that come to us and they'll ask our attorneys and our medical professionals, or for example, we've got a nurse paralegal on staff, and a lot of times the questions arise: who do I see? What kind of professional? What kind of specialist do I go to? And that again, it becomes part of the process is like, look, I think it'd be wise for you to see a neurologist or perhaps go to see someone that specializes in traumatic brain injuries. And again, it's where if you don't sometimes nudge them to do that, they don't necessarily know that they should, right? Even if they have the hallmarks of a closed head injury, they may I'll take some aspirin and some Tylenol or whatever, and I'll rest and hopefully this goes away. And it just doesn't go away sometimes. And again, that's where I think it's wise for
that professional guidance.
Sure.
Yes, it's critical.
Yeah. Tell me, if you would, in your practice, when you see folks that come in with, again, some of the symptoms of a closed head injury, what do you typically see, just to get a sense of what you see?
Well, from the first visit, because on the first visit, they are going to fill out paperwork. Number one, we time it. If it takes the prospective patient an inordinate amount of time to fill out their paperwork above and beyond what we consider the normal, then we become suspicious right away that something is going on. We frequently have these type of people who've had these injuries come up to the front desk very upset, very incredulous about having to fill out all that paperwork. And that's a sure sign that that person has suffered some type of mentation impacting issue like a TBI. Again, as I said, we do a subjective sheet that has 10 of the most common injury signs that alert the doctor and is part of the patient's permanent paperwork. So that can be evaluated. That goes along with our initial report. So a gentle reminder for the legal professional who's handling that case, look, we're seeing these signs of TBI, and that's above and beyond an issue that needs to be at least partnered with a neurologist, and a neurologist who specializes in dealing with traumatic brain injury.
I would also mention that not only do you need the right medical professionals to assess the injury and then treat it, you also want to make certain that you're working with medical professionals that can explain to the client what's happening, and if necessary, can advocate for our clients. Only because, as we know, sometimes these symptoms are subjective, and it's not always a scenario where you can necessarily prove these symptoms other than someone's word, right?
So true.
A client comes to us or patient comes to you and says, I'm lightheaded, I have dizziness, I'm short-term memory issues, etc. It's their word against nobody else's, right? It's them testifying or telling you what the deal is. And that's where it becomes, again, critical to be able to have the right medical professional that can assess things up front, do the necessary diagnostic tests, and then, again, if necessary, be able to, say, hey, look, this is what's going on. This is what I see.
Yep. Finding the right professional is critical, not just a neurologist, but one who has kept up with the latest evidence and techniques needed. Nowadays, with the tools of computerized software to evaluate a patient's visual ability, their vestibular system, which is part of the nervous system, and one of the indicators of an injury, the ocular motor system, another aspect of our nervous system that can be affected, and it has to be treated utilizing very, very accurate diagnostic testing.
You bring up a really great point, because the tests that are used, oftentimes you have a client, in our case, that has such an array of different hallmarks or symptoms. And sometimes it's something that they may not necessarily be, it's maybe not very obvious to them that it's happening. I've had clients that, beyond the lightheadedness, sensitivity to light, the focus and concentration is way off. They have difficulty doing simple math in their head. And again, sometimes you don't really appreciate what's going on, but that's where I say you've got to stop and realize there's something else happening to you, and you got to listen. you've got to do something about it. So again, I think it's a matter of, in our case, trying to make certain that you are listening to the client, trying to see if there's something else there that doesn't seem right, something that's off. Maybe you talk to a loved one and they come in and say, look, this person is having, all kinds of different issues. And, I think we need to try to do something about that. So again, it goes back to the point of doing something about it, right?
Well, the initial evaluation is critical. Number one, the specialist or physician needs to be aware that these type of injuries exist. They're very commonly seen as a result of automobile trauma. And when these conditions are presenting themselves, even if it's subjectively, many different diagnostic tools are available to professionals to determine if, in fact, an injury has occurred and the best way to treat it.
Yeah, absolutely. So much of what we do comes down to what we're able to prove. And
True.
the medical evidence, the diagnostic testing, and the results of those tests, and frankly, the expertise of specialists that can say, look, this is what I see, and here's what has occurred. And it's not necessarily always just for the benefit of us being able to prove things. Many times you just need a client that can make sense of what he or she is experiencing. And I have found that sometimes clients, when they realize that there's something happening and they've been diagnosed with a particular, whatever it may be, in this case, if it is a closed head injury, as long as they understand that this is what happens in an injury such as this is what we can do as far as treatment, it goes a long way to trying to make sense of what is happening to their body. But as I said, not all of them have an appreciation for this is what's happening. They kind of just figure like, I don't know, there's something weird happening, but the right professional, the right specialist can really, I think, make inroads into being able to help them understand and hopefully find a solution, because it is
Very true.
it is terrible. If you have a lower back injury, sometimes you can sit and it's not so bad. But when it's your head and you've got to use your mind to be able to, do everything throughout the course of a day, including your work and your family and everything else, it takes a
So
huge
true.
toll on your life.
So true. Ladies and gentlemen, just to sum up here for you, there are injuries that are above and beyond things you've ever considered. And one of the things you have to appreciate, your brain gets damaged in any kind of automobile trauma. It may be so minor that you don't have symptoms and it heals on its own, but it may be the type of injury, as Mr. Sanchez has so eloquently alluded to. These issues need to be recognized by professionals, and sometimes by professionals that aren't even medical or clinical experts, but ones who have a seasoned background at recognizing when someone just isn't right. So that's why it's so important that you have a good working relationship between your doctor and your law firm. Nowadays, I think your concept, I may be overstepping, but I'm thinking maybe your concept of what an attorney and a law firm does for you is recover money. So much more, so much more. And Mr. Sanchez has already alluded to the idea that you may have injuries you don't even realize you have. Forget about the money temporarily. Let's make sure you get to the right person to take care of you, and he or she gets you to the right person to further clinically take care of you. So once again, thanks for joining me, Mr. Sanchez. I appreciate your time.
Pleasure.
Ladies and gentlemen of the public, I appreciate you coming in and listening to what we have to say in regard to your health. That's it for today. It looks like we're reaching our limit on time, so I'm going to remind you that you can find us on Apple, YouTube, Spotify, Instagram, and on LinkedIn. Yeah, I momentarily forgot that one important platform. LinkedIn is another area where you can go and find information all about health and get much needed and wise advice in regards to how to handle an automobile trauma. We'll see you next week. Mr. Sanchez, I want to thank you for representing Lytle and Ryder and coming in here. And real quick, if you had to get a more expensive insurance policy or a less expensive insurance policy in terms of the benefit it pays out, what would you do?
So thank you, Dr. Usry, for allowing me to be here again today. I would mention that with respect to insurance, I mentioned this to you and anyone else I can, is that get as much coverage as you could afford. And typically, as you go up in coverage, as far as liability coverage, uninsured motorist coverage, uh, if you were to, for example, get an excess policy, coverage typically gets cheaper as you go up. So as I said to you, and I'll tell everyone else, get as much coverage as you can afford, because statistics here in Florida, 1 in 4 drivers don't have insurance, don't have adequate insurance. You've got to be able to insulate yourself if there's some traumatic event that occurs. So that's my advice.
So well put. Great advice. Ladies and gentlemen, thank you very much for joining us. Until next time, this is Dr. Usry and Mr. Steve Sanchez coming to you from Podcast Junkies, and we're speaking all about health. We'll see you next week. Thank you very much. Bye-bye now.